Why do ACE inhibitors cause cough in some patients? It's not due to the drug's effect on blood pressure, it's all about bradykinin. ACE inhibitors block the angiotensin-converting enzyme, which not only converts angiotensin 1 to angiotensin 2, but also breaks down bradykinin. So when ACE is blocked, bradykinin builds up and that irritates the lungs, leading to a dry, persistent cough. That's why patients who can't tolerate this side effect are switched to ARBs, which don't affect bradykinin levels. And yes, this concept is frequently tested on Step 1 and NBME style questions. If this helped, like, share, and follow MLE Masters, your daily dose of high-yield medical learning in under a minute.